This episode of Ask Me Anything, I'm going to be covering a great question I got about the idea of if I treat trigger points and my take on trigger point treatment therapy. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that focuses on working smarter, not harder, allowing them to make well over $100,000 per year with less than 20 hours of time per week in the clinic. Great question this time around from Ask Me Anything. I had a massage therapist reach out to me and say, hey, I had gone through your free training and I noticed that you talk a lot about scar tissue, but you don't mention anything about trigger points. Is scar tissue and trigger point treatment basically the same thing? And they just wanted to get some information on that. So I'm going to try my best to break that down and answer it the best that I can. One thing when I do these is I really just like to give a different perspective and break down things in a different way, looking at it from a whole different viewpoint. You know, sometimes people get triggered. It's funny, they get triggered when I'm talking about trigger points. When you start to question or you start to talk in a different way that might not fit their mold or where they're at. You know, as humans, we suffer from a lot of things. One of those is conviction bias and confirmation bias. Basically, we want information to fit our mold and where we are. And when somebody challenges that, they don't like to do that. So I really like to look at these very factual and break it down. So let's break down what I think and really why I don't do trigger point treatments myself and why I don't think trigger point treatments are a treatment in themselves. When we look at treatment has a couple definitions that I look for, but basically treatment is reducing some type of pathology in the body. And when it comes to musculoskeletal injuries, there's only 7 potential pathologies in the body that you can see. One's going to be a bone problem, 2 is cartilage, 3 is disc, 4 is ligament, 5 is a nerve problem, 6 is a soft tissue problem, and 7 is a tendon problem. I have a whole webinar that I'll link up for that if you're consuming this on YouTube, where I really go into depth about that and really get into the idea of like thinking critically. So what is treatment? Treatment is reducing one of those 7 pathologies. So there's criteria for treatment. Treatment has to have 3 criteria when we look at it. 1, they have to be safe. Number 2, they have to be effective. And number 3, they have to be durable. And those are just the fact base from where they are. So what I want to do is go through trigger point versus scar tissue, give you some information, and then I'll run it through that lens and let you know why I believe and truly believe that treating a trigger point is not actual treatment itself. Trigger point versus scar tissue. So scar tissue is one of the main focuses of my method, the Peak Method. You know, basically scar tissue is like glue that gets inside the muscle, makes it very hard for the muscle to be able to stretch and contract. Scar tissue forms basically just from either an injury or more from repetitive overuse. Basically, not trying to get all smart here, but basically what happens is when the muscles are overly contracted, they don't get enough blood flow and they don't get enough oxygen. That starts some hypoxia and sends a signal to the brain. Body starts laying down scar tissue and kind of goes in there and just looks all discombobulated. So if we look at scar tissue under a microscope, it looks like just all jumbled and all over the place. It doesn't look like good quality tissue. Now, when we look at a trigger point under a microscope, it actually just looks like a normal muscle in there. There's not this like that, like the layering isn't all messed up like it is within scar tissue. So scar tissue is actually a true problem, a true pathology, where trigger point is just a response in the muscle. So scar tissue happens because there's an actual injury there. The muscle's getting overloaded and the body is trying its best to help it. It is more of the cause than the effect. Now, the trigger point is actually done in response to something being damaged like underneath. And that could be one of those bigger problems, like a bone problem, a cartilage problem, potentially a disc problem, a tendon problem, or even a nerve entrapment. So what happens is the trigger point is a response to something getting overloaded. So that muscle starts to tighten up and starts to spasm to kind of get you off of there. So the trigger point is more the effect instead of the cause. And trigger points happen because something deeper underlying is actually getting overworked and the body's trying its best way to get you off of that damaged tissue. The best example I can give for this would be like, hey, when you sprain your ankle, your body knows to limp. That's kind of what happens. The body's really smart at unloading damaged tissue. So The trigger point itself isn't the problem. The trigger point is telling you there's a problem, but it's not the actual root cause of the problem. And when you go back and read some of Travell's work on trigger point therapy, you know, she even talked about that specifically with like trigger points in the QLs and the idea of like getting those spasms. Like she was like, I was treating these, but then they continue to come back. What she actually missed is the why part. You know, those QL trigger points and spasms are happening because there's an underlying problem that they were actually missing. You know, again, going into the idea of looking at more of the effect instead of the cause. The trigger points are tightening up and the QL is tightening up probably because there's some damage to the disc, to the joint, to the cartilage, or even a ligament, I mean, not a ligament, a nerve being entrapped in there. And that can cause some big issues from there. So she even struggled with this. She talks about it in her work. She's like, I just couldn't figure out what was actually, why they kept coming back. She would treat them, but that they kept coming back. They're coming back because something else is getting loaded. So what she really missed was the why criteria. And that's what's really missing a lot. So let's put trigger point into my treatment criteria. I said safe, effective, durable. Safe. Are trigger point treatments safe? I don't think so, because when you go in there and do some work on the trigger point, what it does is it temporarily relaxes that tissue and allows it to do more. So say you got some trigger points in your QLs and the muscles are tightening up, but they're really tightening up because there's a deeper problem in the spine itself. So you unload those trigger points and they get that temporary window where they feel better. But what you're doing is you're actually exposing that disc injury a lot more. So just because they feel better doesn't mean you actually fixed anything. A real treatment should improve function, not just symptoms. And treatments that only improve symptoms are actually really dangerous. Now, effective, I guess. I mean, what is your criteria for effective? Do they feel better? Cool. Anybody can make you feel better in a short window. You can also pop a pill or take an injection and it might make you feel better, but is it truly effective at reducing one of those 7 pathologies that I talked about? And it's not. So it doesn't fit that treatment criteria. Last one is durability. Like, is the treatment long lasting? Can it last for more than a day or two? Can it last for 2, 3, 4 weeks? And that only happens when you're actually reducing pathology. So trigger point treatment is not a durable treatment. It isn't long lasting. You continue to have to treat those trigger points over and over again. It's like you're going to the effect, but you're not getting to the root cause of the problem, which is an underlying deeper problem and one of those 7 problems that we talked about. The jury's out. It's not a treatment. So I don't do it. I always look and I have these guardrails and these boundaries. Is it safe, effective, durable? If it is, then it is considered a treatment. I guess you can put trigger point therapy into more of a maintenance thing. It's kind of like brushing and flossing your teeth. It can help, but it's not going to actually fix it if you have a bigger problem like a cavity down the road. You know, the biggest thing that is missing in musculoskeletal care is critical thinking and really being able to figure out exactly what the problem is. I always say you can't fix a problem if you don't know what it is in the first place. And so many people just want to jump right into treatment and see what happens. I call that a very shotgun type of approach, you know, like just try a bunch of shit and see what happens, but we really don't know what's going on. What I teach in my method, the peak method, is critically thinking, figure out exactly what's wrong. And we do a sniper approach and we know to go in there and do the most effective, safest, and most durable treatment. And that continues to last and we get results from where we are. So put yourself through that criteria. I don't believe that trigger point should even be called a treatment. It could be called therapy, but it is not something that's actually reducing one of those 7 pathologies. So thanks for watching the video. If you like it, give it a comment or share. If you disagree with me, send me a message. I'm always here to have some, great intellectual debate. If you think that I triggered you and I'm an asshole, that's fine too, but I'm just being factual and trying to share the best of my knowledge, because at the end of the day, I want to get people the right type of care, the right type of treatment so they can stay off bigger problems like pain pills, injections, and surgeries that make things worse. Go grab our free training. We go through a lot of this in there. Come take one of our courses. And if you got a question you want me to cover, send it my way. I'm always happy to help, and I will see you on the next one. Bye.